what I'd like to start off this morning looking at the different agencies working together. I participated this last year in the Model Poultry Improvement Program on the task force that you put together with industry, looking at the issue of Salmonella enteritis and an egg quality assurance program. And I feel that, we do a lot of work with industry over on our food and drug side, and I feel that the partnerships with industry, you have to have industry, academia, regulatory, or whatever you want to describe us as, but public health and also food and ag. We have to have better communication and cooperation between those groups in order to really address what the goal is here. And the goal is basically you as residents of California to be able to sit down and have a meal and be sure that that's a safe product. And I know that each and every one of you as business people are working in government that that's your goal too. Because, if your customer's not getting a good product, then that's going to be bad for business. Looking at public health, though, and looking at, from a food safety perspective, what are people getting ill from, you can see from this slide here, and realize the first thing when you're looking at foodborne illnesses, that probably less than 1% get actually reported. I mean, there's a lot of, some estimates that CDC puts out are that 20 million people a year in the United States get a foodborne illness, and there's about 11,000 deaths. And do we identify all those? No. Are we getting better at it? I think in some respects we are probably getting better at it. As you can see, the emerging pathogens like E. coli, and as our laboratory techniques get better, and sometime in the future you'll be able, through aerosolization of bacteria and different techniques, you'll be able to much better identify what bacteria actually made a person ill and do your trace specs. But today, if you look at just in 1993-94, you can see that basically, and what we have is about 50 foodborne illness outbreaks a year in California now. We used to have, about 5 years ago we were having 30, now we're having about 50. And these are where a foodborne illness outbreak is where 2 or more people that sat down and ate a common meal come up ill. And except for 1 case of botulism or 1 case of chemical poisoning count as an outbreak. So looking at what's making people ill in our outbreaks today, you can see here, this is in the outbreaks where an organism was identified back, that basically bacteria are responsible for 85% of the outbreaks. Viral, this is basically the few that we have are viral are basically hepatitis A. We will have some Norwalk virus occasionally. Chemicals here, most of these chemicals are not pesticides. These are ciguatoxin, scromboid poisoning. These are poisonings that you get from fish, and basically it'll give you a chemical, a histamine, or a different type of chemical reaction. That doesn't mean that we don't have aldicarb on watermelons sometimes, but we very seldom see chemical outbreaks. Parasites there, that's basically trichinosis from, what's the #1 hunting license given in California? Wild boars. I think the last time I looked, there's about 80,000 licenses a year, and so some of those can have trichinosis, and we've had some cases related back to those types of things. Okay, now we know that bacteria are the #1 cause of foodborne illness outbreaks, and most of the emerging pathogens that we're seeing, a lot of those are bacteria too. What bacteria are causing the problem? And so the #1 bacteria that causes foodborne illness outbreaks are Salmonella. And I'm not just talking about one serotype, I'm just saying Salmonella in general are the #1 cause of foodborne illness in the United States. Then you have Shigella, you have Staph, and you have E. coli. And the E. coli 0157 now, it's going to be a reportable illness in California, and so we'll probably be getting better numbers on that. One thing that's interesting when you look at Salmonella as an organism, it's like when you look at Shigella down there, I can tell with the Shigella that because that is an organism that's very specific, it's transmitted human to human. So if you see a Shigella outbreak, you know someone in the kitchen had Shigella and they got it in your food and you picked it up. And that's a diarrheal illness. You can get ill with it really quick, and it's a pretty bloody diarrhea. But if you see Shigella, you know that it was human to human transmission. There wasn't an animal involved in that. When you look at something like Salmonella, large percentage of your Salmonellas are from foods of raw animal origin. And so when I look at the Salmonella cases there and go back and look at them, and some of you may have even heard about these, we had a Salmonella typhimurium outbreak just recently that was from a beef cattle that the Hmong, that is a large group of Cambodian, were former Cambodian farmers that now live in the United States. In their community, they went out and purchased an animal, a cow, from a producer, it was basically from a farm, butchered it, took it back in, and there was about 150 of the people that attended this ceremony that got ill from it, and a 2-year-old baby died from that. So that was a Salmonella typhimurium. Another big outbreak was due to pork with Salmonella typhimurium. We had 3 of those outbreaks that were due to Salmonella enteritidis, and they had, it appeared, an egg relationship, and I'll talk about that in just a second. When we look at what is the concern of health officers in Southern California, or what's going on from Salmonella enteritidis, if you look at the nationwide, okay, we just talked about outbreaks. Now we're going to talk about cases. And outbreaks where 2 or more people are involved. A case means that, you know, you go see your physician, you're diagnosed with a diarrheal disease, they send the culture in, and you come up as Salmonella. And California is one of the states that for every case that comes up Salmonella, it's sent all the way to CDC and serologically typed, so we know, is it Salmonella enteritidis, is it Salmonella typhimurium? And what's happened across the United States is, if you look at about 5 years ago, there were about 50,000 cases a year that were identified, and that's dropped now down to about 30,000. But in California, we have been going up in our Salmonella cases to some extent. We see about 6,000 cases of Salmonella now, but not that large of an increase. You know, we were seeing about 5,000, now we're seeing about 6. But the really major change that's happened in Salmonella in California is that it's turning in predominantly Salmonella enteritidis. And this last year, for the first time, usually we had Salmonella typhimurium that was the #1 serotype. This last year, Salmonella enteritidis became the #1 serotype that we see in California. Okay, as you can see right here, is if you go back in 1978 up through about 88, 89, basically during this whole time period, we were averaging, if you look at 5,000 Salmonella cases a year, less than 5% of those were Salmonella enteritidis. Then in the last couple of years, since about 1990, you can see that that started moving up. And it went to, it doubled in 1990, 89 it doubled, 90 it went up to 11, 91 it went to 12%, 93 it went to 18%, and this year we're up to about 36%. I mean, in 1994 it went up to 36%, and this year some of our data, and I'll show it on another slide, is up to about 40%. So 40% of those 6,000 cases are Salmonella enteritidis. So it definitely, we're seeing a change in the type of Salmonella that we're seeing in California. This shows, just to report it, this shows from 94, 95 what's occurring by week. This is number of cases by week in California, and you can see the reported cases up to 1,000 cases over here, and this is all serotypes here, not just this red is all serotypes going across here. And then the percentage, if you look at, maybe it's easier over here. If you look at the percentage over here, what percent of these are Salmonella enteritidis, then you look at this blue line. And you can see that Salmonella enteritidis in week 40 there was over 40% of the Salmonella cases of these types right here were Salmonella enteritidis. So we are seeing some small increase in the number of Salmonella cases, but the interesting thing is that we're seeing a large increase in the number of these that are Salmonella enteritidis. Now, the other thing that's interesting when you look at this is that let's look at what part of the state that they're occurring in. And this blue line down here is California. And so this is the rate per 100,000 populations. If you got 100,000 people out there, how many people are coming up with Salmonella enteritidis? It's running about 3 per 100,000 in the state, but then if you start looking at some of the Southern California counties, the top one up there being Orange County, they're running about 15 per 100,000, which is, you know, 7 times larger average than what the state is. If you look at the yellow one here, that's Los Angeles. They're about 14 per 100,000. Riverside is about 8, and San Bernardino is about 5. So basically, the take-home message from that is that if you look at the baseline being 2 per 100,000 in California, you've got counties that have significantly higher levels than what we're seeing for the rest of the state. So that's causing concern in the Southern California counties. What is different about their Salmonella enteritidis? Why are they having more cases? The other thing is that when you look at foodborne illness, now those were cases we were talking about. Now looking at foodborne illness outbreaks, the 3 outbreaks that we did participate with Food and Ag and that we had in California in March of 1993, we had 3 restaurant-associated outbreaks of Salmonella enteritidis. and there were 44 clinically ill patrons and several were hospitalized. In these outbreaks, when you look back at what was occurring there, it was basically all linked to what I would consider mishandling of eggs, but the eggs were used like in Béarnaise sauces. They were scrambled eggs that were scrambled in large quantities at the same time, so of course you don't, you get maybe a bad egg in there that mixes in with that and contaminates a large volume of eggs. But what happened in this is that when we did go back in and in one of the outbreaks, we found not only you can see that there's Salmonella enteritis, but you can strain type them too. And so like the Fodge type 4 that you've heard about, there's a Fodge type 13A that appears to be 8 and 13 appear to be associated with a lot of the human illness outbreaks, especially on the East Coast. Well, this one of these was associated with 13A, and we did find it in the egg that was beside the oven in the kitchen. We did find it in the sample from the human, and so that's similar to the way that we do tracebacks. If we can show it in the food product and in the person, that shows a correlation. So we did have some micro-linking in this too, besides just the epi information. Trying to do a traceback in this case, it was a common supplier in all three outbreaks, and USDA traceback showed multiple farm and distributions, and it appeared that most of these eggs came from out of state too in those three outbreaks. Okay, so from a public health perspective, what are we doing or what are we looking at? And if you look at public health, we have what are called Year 2000 public health goals. These are nationwide goals. And if you look at, from a food safety perspective, there's basically about 4 bacteria that the Year 2000, the Public Health Service has recognized as really foodborne illness bacteria. Salmonella enteritis is one of them. Listeria is another one where we've put in 0 tolerances for Listeria. And of course, that's going down. Now, Campylobacter is another one that has caused problems, and are looking at ways to work with that. And E. coli 0157H7. Now, what's interesting about those 4 bacteria that the Public Health Service has identified for reductions is that all 4 of those bacteria are zoonotic organisms, which means they can be transmissible from animals to man. So what it means in food handling or when you're doing food processing is you've got to go back and look at the whole system of getting that product to try to prevent that contamination. And so the Public Health Service has come up with a goal of having 21.4 cases per 100,000 of no more than that. And what's happening in Salmonella, and I mean this is what, excuse me, I'm sorry. In 1994, we had 21.4. What they're looking at is a baseline in 1987 of 18 per 100,000. The year 2000 goal is 16 per 100,000. In 1994, we were 21.4. When we got this goal 3 years ago, I guess it was 3 or 4 years ago when we started this goal in the early 1990s, we were below the 16 per 100,000. So we'd already met our year 2000 goal, but now we've went above it. And so we do have increasing incidence of Salmonella enteritis that's causing public health concerns. We're seeing another goal of public health was to reduce the outbreaks of infection due to Salmonella enteritis to fewer than 25 outbreaks yearly. This is nationwide. And in California in 1994, we've had 4 outbreaks due to Salmonella enteritis. Okay. When you look at what's going on in poultry production and could be the areas that you could have an egg that could be contaminated, or how do you get, how do you eat this product and come up with people getting an illness infection from it? As you know, you've got your breeding stock, your poultry flocks that your layers come from, and your layers pass on down, and they can either become infected as when they're laying the egg through vertical transmission. Horizontal transmission means it just comes directly from the hen into the egg, and vertical transmission means it comes straight down from the hen into the egg. Horizontal is when other layers can pass it into the infection to the hen. You can have other vehicles such as rodent feces, contaminated food and water, environments and equipment that can also be contaminated. And I know in your model poultry program what you're doing is there is being a lot of attention paid to these vehicles over here and trying to restrict those in the environment to keep the product from being contaminated. The other thing is that when you get down here to the egg, after the egg is produced, then you can contaminate the egg on the exterior surface of the egg. If it didn't get contaminated on the inside, then it could be contaminated here on the outside if the flats aren't cleaned properly, the washing temperature doesn't clean the egg up or something like that. Then as you go on to the vendors, probably the most critical control point down here is to cook this product properly. I mean, you know, you cook your hamburger and it kills E. coli, you need to keep that in mind when you're cooking your egg too, that if you have contamination on this food that you need to cook it. At the same time, you know, most people, I mean, I like an over-easy egg myself, so I look at it that from a food safety perspective, it's all of these processes, all the way from the breeding stock on through, are important in order to produce a safe product. Looking at, from a public health perspective, what can we do besides participating with your groups and trying to point out some of the public health issues that are associated with these illnesses? What can we do is, some of the things we can do, of course, is to do education to the consumer and to food handlers and tell them about, you know, eggs are foods of, are raw foods of animal origin, and to take special care and precautions with these, because the egg, even if you come in and you're working with some other product on the counter and you don't clean that properly, then you bring over an egg, it's the perfect media for growth of bacteria, and you contaminate it in your cooking process. You know, you did it yourself by doing that, and you need to be careful with these products as you're doing that. One of the things that we're doing is looking at revising what are called the California Uniform Retail Laws, or CURFA laws under Sherman, and looking at, by making eggs potentially hazardous, and I don't want to say that, you know, don't key in on that word, but basically what that does is, by changing that in the law, the environmental people look at it where that requires the food to be refrigerated and other aspects that go into it, because if it's not potentially hazardous, you don't have to have refrigeration of the product. We also want to promote standardized supervisor food handler education, and we have a special committee that's forming on that to look at coming up with standardized statewide supervisor education for food handlers. We also feel that written instructions on egg cartons or packages to inform consumers, say, you know, keep refrigerated, or as an example with the E. coli now, with the safe handling instructions on beef, similar safe handling instructions on egg cartons to help consumers understand how to handle the product properly, I think are important.